When our motor neurons slowly and gradually degenerate and die, we lose our muscle control. Okay, pay attention to this. We call it amyotrophic lateral sclerosis. It's very important that we don't forget to shed our light on it. All right, scientists also call it the Lou Gehrig's disease. Okay, it affects our central nervous system, that is our brain and our spinal cord. All right, it also slows down our upper motor neuron. That means we go to a hyperreflexia phase or we go to a spasticity phase. All right, our lower motor neurons are also slowed down. That means we go to muscle weakness, we go to muscle wasting. What are the symptoms of ALS? We go through distal limb weakness asymmetrically. You trip and fall. You grabbing stuff and then you drop stuff. You walking from here, you fall down. Your muscle is getting weak. You are getting fatigued out easily. You are going through a twitching muscle episodes. Okay, it's not easy. You are going to muscle wasting. Muscle wasting is affecting your diaphragm. This diaphragm we have over here helps expand our lungs to breathe. If we are losing our diaphragm, or if the muscle around your diaphragm is being loose, it's not going to help our lungs to breathe. We have respiratory problems with ALS. Eventually, they put the patient through tracheostomy, and then they put the vent machine over there, where the patient is going to be put on a ventilator machine. You go to tongue atrophy. All right, this slowly and progressively, it just slowly spreads to all other muscle groups. It is very, very, very stressful. It causes patients to go to big, serious depression and anxiety. Okay, the little thing they are trying to do, they trip and they fall. All right, they go to severe morning headaches as well. They are not able to speak. That is dysarthria. They are not able to swallow. That is dysphagia. The muscles are just weakening. All right. How is the doctor going to diagnose amyotrophic lateral sclerosis? The doctor is going to tap and trace and track all the way into the family to see how many percentage of family members were having this ALS, so we can bring it into reality and see what is going on with our patient. The doctor is going to do a deep, thorough, vivid research, that is the nerve conduction studies, to pay attention to this ALS. Okay, we also have to go into the history to see. Okay, and then we also have to do a neuro exams. We also have to do MRI. MRI is going to track and see and then diagnose or be able to tell any tumor that is causing this ALS to take place on our patient. It's very important. All right. Now, what are the causes? The causes are still very, very difficult to fully understand why ALS even happens. But like I said, family history is part of it. Now, age, when people are 40 years and above, 40 to 70 years, they have to understand that they could be prone to such ALS. All right, let's say military experience, when our soldiers respectfully, gracefully appreciating and saluting all our soldiers, but when they go through all that training, all that exposure, all that head trauma on the field, when they come back, eventually, slowly, they go through that ALS as well. It's scientifically proven. All right, we as well, we are not excluded from it. We could also go to environmental exposure that will give us this ALS in the future. We have to pay attention to this. All right. What are the treatments of ALS? There isn't any permanent cure to this, so we're also going to call it management. Okay. The patient is going to be put on a medication called Riluzole or Endaveron. These two medications help stop the spread of this muscle degenerative, causing our motor neurons to not effectively work. This Riluzole or this Endaveron is going to help a lot. That muscle twitching you are going through, the doctor is going to put you on a medication called baclofen or tizanidine. They help relax you. Okay. The muscle cramps that is strongly affecting your nerve root, the muscle cramps, the doctor is going to give you a medication called gabapentin. It traces and goes all the way into your nerve root to help relax you. Okay, and then when they go to all that falling, pain, that comes with all that experience, it is a lot. The patient have to be put on opioids eventually. Now, when me and you cannot swallow from this amyotrophic lateral sclerosis or ALS, we tend to start ending up drooling around our lips. The doctor is going to put you on some medication called glycopyrrolate, anticholinergic medication. Okay, it is very important. ALS also causes patients to go to big time depression because look at it like this. They are not able to get up and walk again. They are not able to get up and go to work again. They are going through a phase of depression. It's very important. We give them some antidepressants to help them a lot. Okay, let's bring them home. What can we do for them when they come home? We have to put them on feeding tubes. We also have to actually give them some thickened liquids, and then we also have to do some gentle stretching. That is a range of motion exercise that helps them a lot. Okay, you walk with them. It's not easy. You leave them, they will fall down right now. So you have to walk with them. They have to get major extreme support from us. All right, we reposition them in the bed so they don't have all this muscle or they don't have all this pressure injury, all right, from skin shearing. It's very important. And then also that reposition is going to help them with great oxygen-rich filled blood circulation. Okay, breathing exercises is going to take place, but the respiratory therapist has to be there to help you a lot with that breathing exercises. It's not easy. All right, speech exercises is also going to take place. We also give them high protein diet. That muscle wasting is causing them to lose weight. That high protein diet is going to help them a lot. Let's not ever forget such people. They were once like us, walking, going to work, smiling, having fun, jumping, screaming, yelling, having great fun with us until that ALS kicked in and they slowly started losing their motor neurons, slowly affecting their muscle coordination. Their muscle control started losing. They started tripping and falling. They started going through twitches. They started going through all these depressions. They had to be put on medications. We had to bring them home. We had to change their diet. We had to change the care we have for them. We have to start loving on them a different, more patient, more calm, and more appreciative way. All right. My name is Nurse Solomon. I'll see you.